This multivitamin and iron product, Folamax 20 mg Iron-1, 670 Mcg Dfe Tablet, is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body and help maintain good health. It is important to take this medication as directed by your healthcare professional to ensure you are getting the right amount of vitamins and iron. Taking the recommended daily dosage at the optimal time will help you get the full benefits of this medication. When taking Folamax 20 mg Iron-1, 670 Mcg Dfe Tablet multivitamins, it is best to take it on an empty stomach, either 1 hour before or 2 hours after meals. Make sure to drink a full glass of water with it, unless directed otherwise by your doctor. If you experience stomach upset, you can take it with food, but avoid taking it with antacids, dairy products, tea, or coffee within 2 hours before or after this medication, as it may decrease its effectiveness. It's also important not to lie down for at least 10 minutes after taking the tablets or capsules. If you are taking the delayed release form or extended release capsules, swallow them whole and do not crush or chew them. This can increase the risk of side effects and decrease absorption. Do not split extended release tablets unless instructed by your doctor or pharmacist to do so. Remember to take this medication regularly at the same time each day to get the most benefit from it. If you have any questions about the specific details for your particular brand, consult your doctor or pharmacist. Some common side effects of Folamax 20 mg Iron-1, 670 Mcg Dfe Tablet multivitamins include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. Iron in this medication may cause your stools to turn black, but this is not harmful. It's important to remember that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects and report them to Health Canada. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. It's important to keep this product out of reach of children. If an overdose does occur, it's crucial to seek medical help immediately or call a poison control center. Before taking this medication, it's important to let your doctor or pharmacist know if you have any allergies to any of its ingredients or if you have any other allergies, as this product may contain inactive ingredients that could cause allergic reactions or other issues. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have conditions such as iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, make sure to inform your doctor or pharmacist if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia. Untreated vitamin B12 deficiency may result in serious nerve problems, so it's important to consult your doctor or pharmacist for details. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking Folamax 20 mg Iron-1, 670 Mcg Dfe Tablet multivitamins. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications as far as possible from your doses of this product. If your multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you use this drug. Remember to keep a list of all the products you use and share it with your doctor and pharmacist to ensure the best and safest use of this medication. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, contacting a poison control center right away is crucial. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed this medication, it's important that you do not share it with others. Make sure to attend all of your medical and lab appointments as directed. Some brands of this medication may also contain other ingredients like docusate. If you have any questions about the specific ingredients in your brand, be sure to ask your doctor or pharmacist. It's important to remember that this product is not a replacement for a healthy diet. It's always best to get your vitamins and minerals from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines provided by your doctor. As for the daily dosage, it's important to take this medication as directed by your doctor. And when is the best time to take this? It's best to follow the specific instructions provided to you by your healthcare professional. If you are prescribed to take Folamax 20 mg Iron-1 670 Mcg Dfe Tablet multivitamins and happen to miss a dose, take it as soon as you remember. However, if it's close to the time of your next dose, it's recommended to skip the missed dose and continue with your regular schedule. It's important not to take a double dose to make up for the missed one. Always stick to the prescribed dosage and timing for the best results. It is important to store Folamax 20 mg Iron-1 670 Mcg Dfe Tablet multivitamins at room temperature, away from light and moisture. It should not be stored in the bathroom, and be sure to keep it away from children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. If you have any questions about how to dispose of this product, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.